everyone, I am Shuyuan Huang, a fourth-year PhD candidate at Yale School of Nursing. I am here to present a systematic review I have been working on with my mentors, entitled Systematic Review of Lifestyle Interventions During Pregnancy and Postpartum Related to Gestational Diabetes Mellitus. Women with a history of gestational diabetes, or GDM, have a tenfold risk of progressing to type 2 diabetes, or T2D, compared to women without the disease. A GDM intervention program covering both pregnancy and postpartum have the potential to address key barriers to initiating and maintaining lifestyle change, hence preventing or delaying T2D. The purpose of this systematic review is to examine the characteristics and effectiveness of lifestyle interventions provided during pregnancy and postpartum for women with or at high risk for GDM to prevent T2D. PRISMA guideline was used to guide this systematic review. The quality of the articles was assessed by the two tools listed here. Our search strategy was guided by a nursing librarian. We searched 7 databases for the articles in English up to January 2021. A total of 1755 records were identified. 66 of them were eligible for full text review, and 11 articles from 7 studies met our inclusion criteria. 6 out of the 7 studies were RCTs, and 1 was quasi-experimental design. 5 studies were conducted in the US, 1 in Australia, and 1 in Finland. Sample sizes of the studies ranged from 25 to 1,783, with a total of 2,569 women. The mean age of the women were 27 to 34 years old. Majority of the studies had diverse samples. The intervention focused on weight management and healthy lifestyle behaviors, including diet and physical activity. One intervention began in the first trimester, while others started in the third trimester. Most interventions only had 1 or 2 sessions during pregnancy. The interventions postpartum lasted 3 weeks to 12 months with various modes of delivery. The postpartum time frame had about 9 sessions on average. 5 studies had good retention rates, while 2 studies had only about 50% completion rates. 3 studies had positive effects on glucose regulation and/or weight, which is important for T2D prevention. Another 3 studies had positive effects on lifestyle behaviors or knowledge only, while the last study had no significant effect on any of those outcomes. We identified key features for the more successful interventions or studies, which included goal-setting strategies, providing individualized care, and had large sample size and good retention rates. To the contrary, the less successful studies tend to be pilot or feasibility studies with smaller sample size and less individualized care. These studies also had less involvement of women during pregnancy and had suboptimal retention rates. In summary, the effect of the lifestyle interventions during pregnancy and postpartum is inconclusive, and more high-quality studies with larger sample size are needed. Interventions studied in pregnancy may help women engage and maintain behavioral change postpartum, which can be a difficult time to engage women in lifestyle prevention programs. Lastly, strategies are needed to help women with a history of GDM maintain healthy lifestyle behaviors emphasized during pregnancy. Thank you for your attention.